Hello, hello, hello. Hi, everybody. I am so excited to come to you live today. I'm not sure. First of all, um, I'm trying to really bone up on my live skills, my going live skills, and so I'll be doing a few more of these as we go. Hello, if you're watching this live, I'm streaming across all platforms, except for I think Threads, which I don't think has a live component yet. Hopefully, it will. Hopefully, it'll still be around in the future. And if you're watching this later on, like recorded, then thanks for watching and please leave a comment. Today, we're going to be talking about LGBTQIA plus healthcare in general, but healthcare for people within the community, from within the community, which is super important. And feel free to drop in the comments where you are zooming in from or beaming in from or watching in from as we do this thing. Okay, so you all should probably know that in America's for-profit healthcare system, the emphasis is often put more on the needs of the companies and the pharmaceutical suppliers rather than the individuals and their communities from which they come. Healthcare in the United States, I'm not sure where everybody's watching from, but healthcare in the United States it's extremely important, but it's oftentimes equally as difficult to navigate, especially considering that nearly 30 million people in the US don't have health insurance. Just for some context, queer people in the LGBTQIA plus community make up 7% of Americans. And in 2022, there were 1.3 million new reported HIV infections. And, that's definitely an improvement over in the middle of the AIDS epidemic. But, with all of the access to knowledge and information that we have and tools that we have, I think that number should be a lot lower. And testing is obviously a big part of that. The House proposed $220 million in spending cuts to HIV services that were previously there before, the House of Representatives in the United States. And 19 states have bans or restrictions on gender-affirming care. And that isn't even the most recent information. And so I wanted to talk to you all a little bit about that. So this is going to seem really sort of American-centric. And, so if you're not watching this from the United States and you are from somewhere else, let us know where you're from and let us know what healthcare is like there. I have some guests that I'm really excited about, who years ago I met these two fabulous human beings who really seem to care and want to focus and put focus on the health of our community. And when I was on Broadway performing 8 shows a week, my back was a mess, and it still kind of is. My neck, my back. Okay. And so I ended up going to them for chiropractic services. And all these years later, they have recently opened up a clinic that offers HIV services and so much more. So please welcome to our show, Dr. Rich Mineski and Tony Walco. Hi.
Hello.
Hello.
How you doing?
Fantastic.
Doing amazing. Thank you for having us.
Of course, I'm so happy that you're both here with us. Now, right now you're in New Jersey. Is that right?
Yes.
Correct.
Okay. Well, we go, I mean, at this point we go way back, right? Doesn't it feel like it?
Yes,
Yes.
It's been a long time.
It's been a long
I remember
time.
seeing you performing CLAT. I believe it's CLAT in like 2014, 2015.
Live. Wait, no.
Yes.
Yes.
That was actually 17. I'm happy to say, yeah.
At the Tropicana or something.
Yeah.
Yeah.
Something. And you in person, just a tidbit. We only performed that song once live. So if you saw us do it live, you were there. Trust me, darling. Yeah, and it was mostly because after doing a show like Drag Race, you become so busy that you don't really have time and you're not really that coordinated. You do see other girls on the road and doing tours, but it really is like the luck of the draw. Like you're there with whomever you're there with. You don't really get a chance to choose. So we wouldn't have been able to like go on tour with each other, you know, me and the girls. I'm looking off to the side because I'm also running the tech for the show, y'all. So
she does it all.
now you both are chiropractors, but can you tell us a little bit about how you went from chiropractic? What's the chiropractic? Chiropractic to HIV healthcare services and other types of services. Can you talk a little bit?
I can take this one. So during the pandemic, we were closed down. We really couldn't see anybody. We couldn't provide any telemedicine services because, I mean, how do I tell someone to adjust themselves? And, you know, so we went back to school to become registered nurses, and then I finished and became a nurse practitioner. And I've specialized in HIV and you know the needs of the LGBTQIA plus community through my educational studies. So we kind of got introduced to this work during the pandemic, and it was funny. Ironically enough, after we were watching "It's a Sin," which had took place in the '80s, but that really I don't know moved me and moved Dr. Mineski in a way, and we were like, well, what can we do? And I don't know, we just decided to start over again and see if we couldn't provide telemedicine services to the masses to try to really address the needs.
You know, one of the things that I think is really interesting is that in a day and age where like telemedicine, I mean, we should be like advancing in terms of like technology and all those things. And that I was sort of disheartened and disappointed to learn that over the past like couple of years or since coming out of the pandemic and slowly coming out of the pandemic, it seems like have been more restrictions put in place across the country, and obviously at state by state, each state does their own thing. But it seems like in various states, especially Florida, there were more restrictions put in place that wouldn't allow. You would think that telemedicine services would just expand, especially in the mental health space, and it doesn't seem like that's the case, which I think is a shame. And I also recently. Well, I'll talk a little bit more about Florida in a minute. But can you tell us about HUG?
Dr. Mineski?
Yeah, I could tell you a lot about HUG. So HUG was founded, we started operations in October of 2022. Our main
Congratulations,
clinic,
almost anniversary.
Thank you. Yes, we're almost at our first year of operations, and we're very proud of our progress in 1 year. Since starting operations in Palm Bay, Florida, we have a second clinic now in Jersey City, New Jersey. We have virtual services accessible in 25 states currently. And we are just really using our resources as a HIV prevention and treatment center, but also using our revenue to give back to our patients. So the big difference is our backgrounds, even though we're chiropractors and nurses, our backgrounds really show the importance of total health care. So we provide our patients primary care services for free. We do nutrition. In our New Jersey clinic, we're giving free chiropractic care. I do some meditation with my background that I also do for our patients that have anxiety and are stressed. We try to give patients access to things that are, especially in America, are a luxury, and it is something that everybody should have, and that's kind of what we do here at HUG.
I feel that. We have a little bit of a message from one of everybody's favorite adult film star, Boomer Banks. Let's watch this.
Hi, I'm Boomer Banks, and I'm here today to talk to you about Healthcare Unity Group, or as I like to call it, HUG. The founders of HUG wanted to create something new and exciting that not only addressed the inequalities in healthcare currently facing the LGBTQIA+ community, but also was easily accessible and free. HUG has physical locations in New Jersey and Florida, but also serves countless others across the U.S. through telemedicine. The core mission of HUG is HIV treatment and prevention, but the services offered by HUG do not end there. Through the patient assistance funds, patients receive medical and lab services, co-pay assistance, financial assistance for healthcare, mental health services, as well as chiropractic and nutritional counseling. Healthcare Unity Group wants to take healthcare to the next level. Here at Hug, anyone can be a patient. Getting your HIV treatment or PrEP through Hug provides those less fortunate the opportunity. Hug utilizes its savings from 340B revenue to provide those at need with quality healthcare brought right to them. Are you located in a rural area? Hug has you covered. Healthcare Unity Group has partnered with multiple labs and pharmacies so that you can discreetly access Hug services without jeopardizing your privacy. Rather than feeling like a hassle, healthcare should feel like a hug. To become a patient, don't wait any longer. Click on the link.
All right. So there you have it. Okay, there's obviously no link for you to click right now, but I'll be posting it a little bit later on. And we're obviously on Dr. Walko's and Dr. Minuski's channels and live streams. And so if you're following them already, then you probably have seen some of this information. But if you're not following them, now's a great opportunity, or right after this stream, to go in and give them a follow. And, so you can keep up to date. But one key point is, or one key thing that I caught from there is, even though, as you both mentioned, you have like actual in-person services in Florida and New Jersey, you also offer services remotely in many parts of the country. Can you talk a little bit more about that and why you wanted to do that?
Sure. So, one of the reasons why I think the pandemic really changed things for us was the data that came out, especially as we were finishing our nursing degrees. All the research was about how safe and effective telemedicine is for many conditions. So, for us, we wanted to incorporate that into queer competent healthcare. And although similar to what you were just talking about in regards to the restrictions on, things we can do over telemedicine, like, gender affirming care, stuff like that. PrEP and HIV management is completely doable over telemedicine for most cases. So that's one of the reasons why we really wanted to incorporate that into the bedrock. Plus, I mean, it is so easy. We really try to make it convenient and accessible for anybody who wants our services.
Okay. I mean, that's really important when, just navigating the system is like enough of it. It feels like a part-time job for a lot of people. I could just show Dr. Walko. I could just show your video. Let's just show the video of you talking a little bit more about it. There's some things that might have been repeated in there, but I like the video. So here's some more information for y'all.
Of the Healthcare Unity Group, and I'm here today to answer a question that we get all of the time, which is
they're never going to get that.
CEO of the Healthcare Unity Group, and I'm here today to answer a question.
Okay, it's not going to come. I played it earlier.
Dr. Tony Walko,
no, I'm going to make
CEO
it.
of the Healthcare Unity Group, and I'm here today to answer a question that we get all of the
Y'all.
The suspense of the answer.
The suspense of being
Hi, everybody. I'm Dr.
not
Tony Walko, the CEO of the Healthcare Unity Group, and I'm here today to answer a question that we get all of the time, which is, why should I get my HIV treatment and PrEP services from Hug? Where you get your PrEP and HIV treatment really does matter. Our organization is grant funded, which means that if we put you on PrEP or HIV treatment, we are able to fund our clinic, which means that more individuals get access to queer competent healthcare in the form of copay assistance, insurance assistance, food assistance, virtual and in-person primary care services, as well as chiropractic, nutrition, and mental health services. Being a Hug patient, not only do you get access to all of the services that we had mentioned, other patients get access to them as well. If you are currently treating with a healthcare provider that you love, we would love to be a part of your collaborative team. You don't have to leave your doctors. We offer our services in conjunction with what you're already getting. And if you're using another online platform to get your PrEP, I would ask you to look into what are they doing with their profits. To get started, visit us at www.hugnj.org. Again, www.hugnj.org.
Fantastic. Okay, it was like Ghost in the Machine. It just didn't want to do it while I wanted it to go. You mentioned that you're both nurse practitioners, and one thing that I think is really interesting, and I think this was in Florida, is that restrictions. I believe it's Florida that most people see nurse practitioners, for their when they're getting their primary health care, at least, and that's anecdotal, but I believe that most people are at least getting their medications prescribed from a nurse practitioner all over the country. I know that when I go to see my doctor, it's a nurse practitioner, you know, um, and there is a physician there, like at the office and everything. But so which is why I was surprised, but not so surprised to hear that restrictions in Florida are, I don't know if they're proposed or if they actually went in place, that put limits regarding gender affirming care, on people being able to receive their hormone replacement therapy from nurse practitioners, that you can't receive it from a nurse practitioner. The goal is not to block people from being able to get their prescriptions from a nurse practitioner, rather than instead having to go to a doctor, which is a little different than a nurse practitioner. And so I just, do you, is what's going on in Florida, that the fact that you opened up in Florida first must have been, in response to everything happening, in the last 2 years with Florida, right?
Yeah, Florida has been a mess. And, to be honest with you, we went to one of the most conservative areas in Florida. We are about an hour outside of Orlando.
Oh,
Oh, oh,
sorry.
hello,
You're back.
I'm
Hour
back.
outside of Orlando. Keep talking.
So we're an hour outside of Orlando, and realistically speaking, we're trying to help the individuals there who wouldn't get access to these services otherwise because they don't live in Miami, Orlando, St. Pete. So and laws that you're referencing, they're just made to just restrict people from getting access, which is the exact opposite of what the research is showing we need. We need to allow nurse practitioners, physicians assistants, really anybody who's qualified to be doing this work, because we just have so many healthcare disparities in this country. It's ridiculous.
Oh, good grief. It is the truth, y'all. It feels like, coming out of the pandemic, I remember just being so exhausted with so much stuff. And the fact that we're getting ready to go into 2024, we've already entered the moment in time where politicians are like using us for their political gain, and like throwing human beings under the bus, slashing the rights that people have, and putting restrictions on this and bans on that, things like healthcare and access to, equal employment and bodily autonomy. And so sort of what I would call concierge health services like this are increasingly important. And so if you live in an area where you're not able to access the services that Healthcare Unity Group provide, then hopefully you can find something like it, because who knows, like the fact that like most people are uninsured, many people are uninsured anyway, 30 million people are uninsured anyway. But even if you have insurance, there could be restrictions put in place that would stop you from being able to access things, either because of the price, the costs are so high, especially when it comes to pharmaceuticals. And then if you might have to travel to another state to get the services that you need anyway. And so I wanted to do my part and bring in uplifting people who are addressing that, now, because honey, if you're waiting until you're in pain or something's wrong, it's just not going to be the right time. We don't want to wait until after the fact. We need to be proactive and preemptive with our healthcare. And I think forming relationships with people in the community, people are part of the LGBTQ plus community who are focused on that, is key. Because the last thing I wanted to do, I remember when I was starting my medical transition, I didn't like, it was scary enough navigating the healthcare system, period. But then having to speak with somebody who didn't have any connection to the queer community and just was talking to me like they were a stranger, it's nobody wants to feel that. When you're going to your healthcare providers and your mental health care providers, you want to feel safe and you want to feel like you have a connection with them. And so I think that's something, it sounds like something that the two of you are doing really well. I'm going to go into the chat and see if anybody has anything to say from the chat. Yeah, they're acknowledging that the healthcare system is broken. Somebody from Long Beach
Amen.
on the thing. I don't know if you saw that. Somebody from Long Beach has something to say. Yeah, we got a few people just acknowledging what's going on with the American healthcare system. This person, Brandon is Stark, has a question. I'm just going to ask it right on. Oh, it's can't see the whole thing. But Brandon says, I'm curious as to what you think the best way lawyers and lawmakers, I have to take it off screen to read it, lawyers and lawmakers to talk about health, talk about issues with medical professionals, lawyers and lawmakers to talk about this. Too often you see politicians, et cetera, write laws without even consulting experts. That's 100% true. How do we bridge the gap? What do you think about that?
I mean, I have an opinion on it.
Say it,
I
darling.
think this is
Let it spill the tea.
this is a great segue, and I'm going to go a little bit more global than that and just say that this is a pivotal time in our history that people need to start thinking for themselves as we discuss these things in our healthcare system. It is a broken system. It is not meant to keep people healthy. It is not here to really take care of us. And it's important for professionals, healthcare professionals, lawyers, and even people who are getting these services to support organizations like ours and to band together to make more noise to actually make a change. The problem is we fall into this pattern of kind of like submitting into saying, well, this is just the healthcare system in the United States and that's it. And it's we have to be bigger than that. We have to be more passionate, and really we have to be courageous in what we believe in, just so that we can make those changes and say that this is not okay. And I that's just where I'm at.
And another point I'd like to bring up too is we really need to make sure we're protecting the 340B drug program, which is how we are funded. To answer Brandon's question, so they are trying to attack this program, and this is a program that provides for safety net clinics like ours, and also disenfranchised hospitals, all of that, and they are always constantly between the drug makers trying to cut their responsibility from participating in the program, as well as lawmakers trying to gut it. It's really unfortunate. So I would say, Brandon, if you can get involved with anything related to the 340B drug program, you would be doing a great service because we need that.
Maybe you should just explain like how our revenue works so that
yeah. So, so most of your clinics, right? Your Callan Lords and all of that in New York and Hug and all of these clinics, if you are grant sponsored, whether from the state level, from the federal level, you get, as an organization, reduced prices on medications. And the idea being is that you are supposed to take the what's left over after everything is paid for the medication and put it back into the community. So that's how we take, our 340B savings and we pay for our patients' labs. We pay for copay assistance. So basically, the idea being is you're supposed to take that money and put it out into the community that you're trying to serve. So it is so important because certain drug makers no longer want to participate, even though they're federally mandated, but they're trying different ways to cut around it. So it's a shame, but that's what I would truly recommend getting involved with.
I think I really appreciate being able to have this dialogue because we talk a lot about the American healthcare system and that it is broken and that it is like the capitalism is capitalizing when it comes to the American healthcare system and the profits that just seem to just go all around, but the patients seem to be oftentimes left out, not in terms of getting profit, but profiting from with their health, right? And so I think having an ongoing conversation and allowing people to have a little bit more understanding about how the healthcare system works and how the services that they're being provided and that they're able to take advantage of, how those services get to them, I think is really key because it's no longer just like you go to like the doctor wearing a white coat with that thing on their head. What was that thing? What's that thing for, y'all?
It's a light. It's just a light.
Oh.
just so they can poke around in all your crevices.
It's no longer that. It's no longer an apple a day keeps the doctor away. Like we're no longer in that world. And so navigating these things, and then sort of now that drug companies are, this is a little bit off topic, but we see, as after watching film, uh I can't talk, I'm SAG, so I can't talk about film and TV. After watching certain programs that talk about the pharmaceutical industry, and that they are the change that happened, I think, in the 90s, where pharmaceutical companies started advertising and putting out commercials and advertising direct to consumer, so that people are
Right.
shopping. If you're doing that with your drugs, then you should also do that. Like, you should also sort of figure out the best providers for you, and sort of not date, but like, sort of find the providers that are doing things that you think are good and benefiting the community,
Mm,
rather than just going to your assigned person. That if your
mm,
insurance will be like, okay, you're assigned to Mary, who's an hour away, and she don't know nothing about the
Hmm.
community, and like, couldn't be more removed. And I'm not saying that those providers are not in it to help people, because I believe that they are. If they're, there's you know all types of people in every profession, but your health care is probably going to be more comprehensive when you talk about total health care, if your healthcare providers have a full picture of who you really are, and
yeah.
how you move about in life, and have a dialogue with you, so that you feel comfortable and safe. I know that a lot of people that a lot of the sexual partners of trans women, for instance, identify as heterosexual. And anecdotally, a lot of the girls that I talk to, um, and I know that this is also a thing in the queer community in general, the conversation about like testing, with regards to not only HIV, but also all STIs, usually happens after the sexual encounter, if it happens at all.
Mm,
And
mm,
it's good that it's happening at all. But from my perspective, and the people that I've encountered and had sort of relations with, and a lot of the stories that I've heard from other girls, is that it's from the aspect of like, you're clean, right? And that's the conversation.
Mm.
We're not talking about when, they're only concerned with you're clean. That's the terminology that they use. I don't use
Oh.
that terminology anymore. But not really wanting to ask about, when did you get tested? What were the results of your last test? How often do you get tested? And things like that. Are we going to, and then like consenting about what types of protection we would be using, whether it's condoms, whether it's PrEP, you know, treatment. This is a dialogue that people need to be having if we want to address the 1.3 million new HIV infections every year, right? Um, I do want to ask, there's a couple questions. I want to go back up to Anna. Anna had a statement about the fact that the American healthcare system is reactive, and we need a proactive system. And then Anna speaking about how can we get out of the anti-trans situation that we're in right now. And a lot of that is legislative, and a lot of that is political. But when it comes to healthcare services, and the fact that there's a lot of people who have trans experience who are probably thinking that, we're seeing people moving to other states, moving out of Florida, moving from state to state, in order not to either to get away from the discriminatory laws and policies, but also to go to places where they can get the services that they need. And when it comes to trans folks and their families, what are there any services that you are looking into putting in place? And is there a way that you are thinking that, how, tell us about your opinion on all that.
Sure. So for trans individuals, we provide care, but we're restricted, really restricted to people who are around our clinics, because we have to be able to follow the DEA guidelines, and because hormones are a controlled substance, we are very limited on doing that through telemedicine. But we are trying to see where the post-COVID laws fall with that, because that may be a little bit more relaxed for your Schedule 3 drugs. But Dr. Maneski, how do you think, in regards to changing the atmosphere for trans individuals? What are your thoughts on that?
absolutely. I think it's all about connecting people with the resources. And the one thing I can say about Hug as Dr. Walco and myself are, a big part of the team here at Hug, is if we don't have resources available that you're in need of, we will make sure that you get connected with somebody or an organization that does.
Mm.
We no
100%.
longer are in the health. We're not going to sit in healthcare and see people be neglected on a daily basis with no options. It's so common for doctors to just say, I don't accept your insurance, or I don't do that treatment. And then it's like, well, what does the patient do? And we live in a world where people get very overwhelmed and scared, and they will resort in not taking care of themselves. So I think that the best answer to that is just that I could speak for ourselves, where we would help you get connected to resources that you need. And as we grow and expand, getting the word out there and what we're doing, we're going to provide as many resources as we can, because that's what we're here to do.
I also want to just plug a website that I think is really helpful. It's called outcarehealth.org. It's a website, it's a directory where providers who are LGBTQI plus friendly providers, and they're kind of saying this themselves, so of course take that with a grain of salt, but you can put in your zip and you can put any type of doctor. If you even want an acupuncturist, and maybe you're a little concerned about your status and disclosing that, or a dentist, you will find all of those providers. So that again is outcarehealth.org, and I highly recommend using that as a resource.
I wish I could I can put that up, but I don't. But I'm doing too many things with the tech here. So
No worries.
outcarehealth.org. Thank you for that. Y'all put in the unity in community. And I think that's really important. There's one question that somebody has about their sexual health. It seems pretty general, but it's in the chat. It's by Hi. If you scroll up a little bit to 4:09 p.m. I'm not sure
Yes.
if is that something you'd care to answer on camera?
Sure.
Or okay,
Absolutely.
I'm going to put it on the screen if that's cool.
Absolutely. Self-treating yourself is never a great idea, because a lot of these STIs are, they are in fact.
Wait, first let me ask the question for everybody.
Sure.
Hi says, I have a serious question. I got to know. I might have an STI, and I Googled and took some doxy antibiotics myself. Am I cured? Was that beyond foolish? So there's the content.
So of course, always consult with a healthcare provider, especially if you are in one of the 25 states. Reach out. We are here to help. The only way to know if that doxycycline actually worked would be to test all three spots, so throat, and I'm assuming I don't know Hi's assigns sex at birth, but if they are a gay male, checking the throat, the rectum, if they engage in receptive anal sex, as well as the penis. So if you're having any symptoms, you have to check all three spots to make sure that you're eliminating all three spots. But yeah, don't self-treat. And we're there's a lot of organizations like us that can test you and get you cured.
And if you didn't take the right antibiotic, every sexual experience you may be infecting other people.
Right. Just because the symptoms go away doesn't mean the infection went away.
I also saw a question about quality, or I saw somebody make a comment about quality of food, and I would love to just put a little piece in about that too.
Yes, please.
Over here. So one of the services that we offer in conjunction to your HIV and PrEP care at Hug, I personally do nutrition, any patients that are interested. And what I do is I take food diaries of the patient as well as their food preferences, so that we can really educate and teach people how to make choices that are going to fit within the world that they eat in. And I think a lot of people are missing that knowledge of when I have these options, what is best for me. And that is something that we do here at Hug. We really listen to our patients and give back feedback that's unique to you. It's not going to just be what the nutrition recommendation
the food pyramid
is. Yeah, which is outdated and wrong. So Yeah,
Right.
Oh my God, I do remember that food pyramid. Stevie says, literally watching this stream while reading my STI results from my doctor's appointment last week that I have an STI. Thank you so much for this community. Yeah, I think it's really important that we sort of destigmatize the sexual health, destigmatize sex in general, but our sexual health when it comes to testing, there's a lot of sort of fear that goes into getting those results back, and I can understand that there might be some results and diagnoses that are more less desirable than others, but it is really important. I believe it's really important for myself. It's really important to get regular STI testing every single time I go to the doctor. I go to the doctor for more than just sexual health, but I get tested. Even if if it was like today and tomorrow, then I'm not going to do it twice in a row. But the minimum is every 3 months, but sometimes it's even more often than that. For HIV services, it's like for HIV testing, 3 months is probably, you all would tell me, the most frequent that you would realistically go. But I go, like, if I have to go back again in 2 weeks, I'm just going to get tested again. Even if I haven't had sex, I just make it a part of my routine. Every time you go in there, it's almost like going to the dentist and not having them check your mouth. Like, what's the point? So you go in there every single time, get checked. And then it makes it just so much easier and so much more routine and so much less scary. And that's how I like to navigate things. I have a couple more questions here, but I don't know if you want to say anything on that.
No, I agree 100% because honestly, we don't stigmatize people who get a common cold. We don't stigmatize people, who have other health conditions. And I mean, it's truly just a bacteria, right? I mean, that's just what it is, or a virus. And we create so many more issues for people around their mental health by creating this big mess. So truly get tested. And I think there's a question I'd love to answer, Sierra
Is it
Harris.
from Sarah Harris? Okay, great.
Yes.
Yeah. I'm putting it up. Go ahead.
Perfect. Thank you.
It says, hi, thank you for the stream. I have a question. Is a condom / protection during oral a thing? Because I always wondered if an STI could be transmitted this way.
So, believe it or not, yes, it is. Dental dams are a thing. Using condoms are a thing during oral sex. And I think the reality, what I love about this question, why I had to address it, is because most people would never think to use a condom. And to be honest with you, most of the cases of gonorrhea and chlamydia that we are finding are either wrongly diagnosed strep throat or unbeknownst to the person, they have a chlamydia and gonorrhea infection in either their throat or their rectum. So, I mean, if you think every time you have oral sex with someone and you aren't getting your throat swabbed or your rectum swabbed, you're passing that along. So yes, they are definitely a thing. You can definitely get STIs. HIV has a very low transmission rate orally, still possible, but very unlikely. But yeah, chlamydia and gonorrhea, oh, absolutely.
Do you see that question? There's a cute question from Wagon Will Watusi. Not this.
Dr. Nestor, you can take that one. Go ahead.
Yeah, it says, do doctors have pet peeves with patients? Like, what annoys you about us for real? I'm assuming that this is in hopes of becoming a better citizen in the healthcare community.
Ooh, private practice, definitely. Now it's more about really taking care of people and seeing them for all that they are. A lot of people's things that may annoy a doctor or anything, you actually have to remove yourself looking at the situation and really see. A lot of people are, like I said before, are in fear. They don't have resources that they should have, and they're just scared. So a lot of things that may be annoying to a healthcare professional from that point of view may actually be just things that we don't understand that's happening. So I think nowadays nothing like that really happens. I would say maybe my pet peeve is just missed appointments, just because we have other people that could be getting those services. But again, we still have our arms wide open for anybody that misses an appointment or needing us still, because we're not going to.
I have two I'd like to add. When you're putting your address and you live in an apartment, put your apartment number. That's your address. Two, when we have a text messaging software where you're getting alerts I'm not messaging you just for the fun of it, right? Sometimes I do. I will ask a patient, like, how did such and such go? But truly, we can only reach you if you respond. So please check
Mhm.
your messages and put your apartment numbers.
Fair.
Oh, that's good. That's
Those were good.
clerical clarity.
Well, we send all of our medication through the mail for most patients, so we
Oh
don't
yeah,
want it to,
yeah.
yeah, it's got to go where it's got
Now,
to
are
go.
there restrictions? What are the sort of how do we wrap our head around receiving prescriptions across state lines?
Mhm.
So
Is
we
that just
have to
like
be
sending a
licensed.
letter across the mail? I don't know why I have it in my mind that mailing things or getting medications, prescription medications from state to state would be problematic or hard or tough to do. Maybe that was just something I
Yes,
invented.
it is. No, no, you're
Oh, okay.
100% right. So we happen to work with Avita Pharmacy and as well as Coordinated Care Network, and both of those pharmacies,
Avita like Ava Perone.
yes,
Okay.
similar, yeah. But so Avita Pharmacy was started back in the 90s. I think they were under something else, but they actually did the legwork so that they can fill, I believe, all 50 states. Haven't found one they haven't been, but I'm almost positive. So that from a pharmacy perspective, your pharmacy has to be licensed in the state that you are in. So Avita will ship their patients' medications all over. And if you change month to month, if you're a flight attendant, something like that, they got you covered. From a doctor's perspective, we have to be licensed in the state that we're in as well as the state that the patient's in. So that's why, we can't see patients in, certain states that we're not licensed in. So
Mhm.
it is challenging. We've kind of done the legwork and partnered with people. We also, I would like to point out too, have an organization called Pride Life that actually helps patients in, I want to say, almost 50 states get on health insurance plans. And they actually help us write grants so that we can get these plans covered so that patients are not walking around without insurance. So please, if you are on PrEP and you're not insured because you're going through the Gilead uninsured program, do yourself a favor. Come to us or go to an organization that will help you because you have other health needs. And we want to make sure everything's getting addressed, not just your PrEP. Um, Julie.
Okay, I got a few more rapid fire questions before we
Sure.
wrap it up. Wrap it up.
Ah!
You got that right. Wait, not that. That's the wrong one. Uh. Oh wow, these the questions are. How do I shame about my daily life past experience? I'm gonna you day. I'm gonna answer this question. Overcome shame about. Listen, I think overcoming shame about anything in the past, because a lot of the things that we do in our past, there, Brene Brown says if it's hysterical, it's historical, meaning it goes back to things that happened when we were younger or earlier on in our life. And so when you ask about shame in your past relationships, and how do you overcome that? I think, engaging in mental health services is one way that you can do that. You know, there's, it's perfectly natural, I think, to carry shame about certain things that we've done before. But I think that's really about working through your sort of expectations for yourself and your own behavior and your own how you're judging yourself. If you were in a relationship and you did something, you probably, like you're human. We do things in relationships all the time, and we certainly attract people and get into relationships with people that, in hindsight, we realize we're not good for us. And dating it's tough out here in these dating streets, but mental health services, if you're carrying something that from a previous relationship that is affecting you today, then maybe get looking into some mental health services, which is it's way easier said than done, are important for you. You can go to the folks here at Hug, and you can start with them to see what services that you have that are available to you in your area. Something tells me you might not be in the United States though. This Aubrey Auntie Kuntor, okay, asks, please clarify, water-based or silicone for anal sex? I know my preference.
Well, yeah, I was about to say what I prefer. Listen, whatever, just make sure there's enough on there. Truly, the making sure that the area is nice, wet, like a slip and slide is the best thing because the more friction, the more chance of them catching an infection of any sort. So,
I'm so happy to hear that. That like goes along with my preferences anyway. Wow.
Do you want to just touch on toys and just to be
yes,
careful?
well, that's also that great point, Dr. Mineski. So, if you are using silicone-based toys, do not use silicone-based lube. It will break them down, and not at the right time either. You do not want silicone breaking down in your body. Yeah.
Yeah. Yeah, that's for real. We don't want loose bits of silicone going around. Um this person asks, isn't having sex while being this is okay, there's a little bit of a moral judgment going on here, but isn't having sex while being closeted really risky? As what I know, we need to see a doctor regularly, but in little towns, etc., it's really likely for you to be outed in hospitals. Is something I don't.
Basic
Is something enough?
protection is basic
Is
protection
basic
enough.
protection enough? Um,
Oh,
you want to answer that? I will address some of that. Yeah, you know what? You're not, this is kind of what I was hinting at a little bit, or, intimating a little bit earlier with regards to like, conversations about sexual health and really having good communication with your partner, even if it's a casual sex partner. Just figuring out what information you want to disclose, what information you need to disclose, what information you want your partners to disclose. And so it is a little bit kind of awkward sometimes, but it is really important to do. And I know that people think it kills the mood, but beyond that, which I know your question is a little bit more beyond that, I have met people who mainly guys that I've talked to that say that they don't want to go in for testing because they don't want people to know, or they don't want to get swabbed rectally because they don't want people to know that they have anal sex, things like that. And I think that some of that might be able to be avoided with organizations like Hug, because you're seeing healthcare providers that are not necessarily coming in with those type of judgments and moral sort of hangups that I know exists in other doctors. And it is a little bit different, someone having a fear of being outed versus going to a doctor who's going to treat you poorly and judge you. Those are two different things, but they can both happen in the same visit. And so, I do think it's important to try to connect yourself to healthcare providers and services that are going to be supportive and are maybe that you can learn something about your own sexual health from, how often you should be getting tested and what the treatment should be and what you should be discussing with your partners. That's something that maybe your doctors can sort of counsel you a little bit on. I know I talked a lot about that, but please jump in, y'all.
I would
No,
love to.
I think it's a great question because honestly, first of all, being in a space, whether even it's a virtual space like this, helps normalize these conversations between a doctor and a patient. We do not have any judgment. In terms of outing, the only time that your results are going to go outside of that office would be if you tested positive, and that is only going to Department of Health in your state, and that's a law. Nobody can get around that. But truly, if you're not getting tested for things like syphilis, chlamydia, gonorrhea, they're easily treatable, but left untreated. I mean, Al Capone died of syphilis. It will literally rot away your brain, and it's really curable easily. So, I understand that fear, and if you're using protection, barrier, condom, stuff like that, your chances are much lower. But if you're engaging in oral sex or anything else without protection, truly you are at risk.
I would love to just chime in on a couple things too here. So the first thing I wanted to just address was risk. Risk is for anybody that's having sex. It doesn't discriminate with anybody. You do not understand or know who your partner has recently slept with when you're
Even if
doing
they
that.
tell you.
Even if you're married, we have seen everything doing this work. And you might think that you're in a monogamous relationship, but there's two people involved at all times. So when people aren't HIV positive, PrEP really is it's a really big introduction into your care because it prevents you in case of something happens that's outside of your control. And the only other thing that I really wanted to mention is if you're afraid of being outed or anything like that, our organization does fully virtual services so that you could do it discreetly from your home. We ship our medications to designated locations where it's safe for you to receive them. We're here to keep everybody safe while they're doing what they're doing without making you feel bad for what you're doing. So it's all about taking and getting tested. If you're not getting tested, you're just closing your eyes and pretending like there's no chance that you have something, but that's not how it works either. So it's important to
Right.
do all of those steps.
How often do you think people should get their STI testing? I know I talked about what I do, but how often do you think is a good? How
I
often
would
would you
say if
recommend?
you consider yourself a sex worker or, you know, you're exchanging sex for any type of material goods or whatever, I would say monthly, truly. If
Hmm.
for everyone else, I would say if you're sexually active every 3 months, we typically don't allow a patient to stay on PrEP after 6 months because it's just too much of a risk. But you know, there's always that fine line between, you know, not kicking someone off of really important medication, but also making sure that you're ensuring their health. So I would say definitely an average is every 3 months.
Can you explain a little bit? Can either of you explain a little bit about PrEP and what it is for people? Uh, because I think there's still a lot of people who don't know.
Do you want me to take it, Dr. Mileski? I feel bad. I'm
Yeah,
just
you're.
so PrEP is basically what they found was that if you used so most HIV treatments were a three drug regimen, right? They realized that if we took two of them and gave them to people, that it would protect and build up in the cells and protect. So when HIV tries to get into the cells, it has nowhere to go and then it's gone. So Truvada was the first one. Then Descovy, which is a better version of Truvada, essentially. It's less impactful on your kidneys and your bone density. And now we have Apretude, which is an injectable. The only thing I will say with the injectables is you have to be really good with your timing. If you miss your appointment with your doctor, you only have a narrow window. Um, but you know, between those three options, there's no. I've heard it all, right? People say, "I don't want the virus in me, so I'm not taking PrEP." There's no virus in the PrEP. It is two medications,
Mm.
and it's basically the best way to think about it is you're kind of taking a lower dose of HIV medication or a lower regimen in the hopes that you know, with the protection from the HIV so that you don't have to live on antiviral therapy for the rest of your life if you are in fact HIV positive. So, you know, and the drugs are getting better and better. And I would say Descovy and Apretude are great options. And so is Truvada, truly.
Hmm. That's a good answer. Any other minute questions from anybody? Feel free to ask them now because we're going to be leaving before too long. But I just want to say thank you to both of you so much for spending the time with me and answering these questions. These questions, and people are beaming in from all over the world. We don't know where they are, but if you are in the 50 states, make sure you go to the website, which is, oh, can somebody say, oh, yeah, tell us about the website and everything real quick. I'll be right back.
The website is www.hugnj.org. So hugnj.org. And I'm sure it'll be
Yes.
posted. I
And if
don't know if
you
I can.
want to message us, the best thing to do, there's a text messaging button right on the top. You just click that, and we will send you a message. It's going to come back encrypted, so you're going to have to click on that link. It's not a virus, it's not spam. Everything we do has to be HIPAA compliant, so it has to be end-to-end encrypted. So the best thing to do would be to click that text messaging link on the top bar, and it'll take, if you're on your phone, it'll open up a new text message window and ask us whatever. Truly, we're here. Um, you know, whether you're interested in PrEP or HIV treatment or you need resources outside of the 25 states, I mean, honestly, Dr. Mineski has nothing to do. So.
And for
Just
those of you
kidding.
interested in services related to trans healthcare, I am going to be doing a session specifically with a surgeon who provides gender affirming care and surgeries surgical services for folks in the community. Coming up pretty soon, and I'm really excited about that. We're planning that out right now, so it'll be another similar live stream like this. But you all are amazing. Thank you so much for spending the time with me and
Thank you.
you know, talking about the services that you provide and taking the initiative to really you know, making that first step so that it's easier because you're stepping closer to your patients when you're doing this kind of services and offering this care, and we're talking about it. I think that for me that feels like the services and the what you're providing is taking a step closer to me and taking a step closer to people in the community, and that's really hard for people to make that first step on their own. It's scary, it's daunting, they don't really know what to do, it's overwhelming, probably on purpose. And so when you all are just you know, emerging as the types of providers that I know I would want to go to, warm and friendly
Oh,
and yeah, caring. And so thank you so
Thank
much.
you so much.
I am really grateful for you all. Stay on the stream as we end, but everybody else, thank you so much. Make sure you go to the website, follow them both, and engage with their social media so you can get more updates on what they do. And you all are amazing. Thanks, everybody.
Thank you.
Bye.
bye.